Hello and welcome to The Road to Better Spine Health with the Spine Doc, Dr. Pasquale Montesano, MD, of Montesano Spine and Sport, with offices in Palm Beach Gardens, Naples, San Juan Capistrano, California, and the world over. Good afternoon. I'm Brian Content. I'm going to be here each week to help facilitate discussions with the distinguished Dr. Montesano on a wide range of topics associated with spine health and wellness. Hello, Dr. Montesano.
How are you doing? It's wonderful to be here before Christmas. I'm very excited and wondering what Santa has in store for everybody.
Well, hopefully good health in the coming new year. Let's first begin by talking about your mission as a spine doctor and a surgeon, but it's way more than just surgery.
It is, Brian. You're absolutely right. And I started my whole career really at a young age and as the son of a mother who was paralyzed and understanding what proper spine health was, but most importantly, understanding, coming from wonderful, loving parents, understanding what it meant to have a positive attitude, even when everything seemed to be dark. I think that we start with having a positive attitude. We add nutrition, we add exercise, fitness. These are the things that are going to prepare us to have a healthy spine.
Now, not to embarrass you, but I think it's fair that our listeners know a little bit about your background. Very distinguished Bachelor of Science from Siena College Medical School, New York Medical College, extensive postgraduate training. I can go on, including the Volvo Award in Clinical Science and the How Medica Spinal Fixator Grant. A lot of people probably don't know the significance of these accolades, but maybe you can just talk a little bit about some of your training and background and how you came to be so renowned in your field.
Well, after I finished my training at the University of Kansas in 1986, my chief there sent me to Switzerland. At that time, America had fallen behind in spine. A lot of the new ideas, the innovative ideas, were occurring in Switzerland and Austria and in Germany and in Italy. So I toured those countries and basically spent time with all of the masters there. So when I finished all of that, I came back to America. We had already completed our study on low back pain. We submitted that, and we won the most distinguished Volvo Award. At the time, it was the most distinguished award in low back pain research internationally. From there, I got recruited to the University of California, Davis, where I ran the adult spine program and became one of the first people in America to use the modern fixation techniques that were developed in Switzerland, many of them developed by one single person, that person being Fritz Magro from Austria. I went to UC Davis. They saw and probably still see the largest volume of spine trauma in the country because it's positioned in Sacramento, California, where you have some unique features. You have two clean rivers that pass through the town, and you have two major highways, I-5 and I-80. And on I-80 and I-50 going up to Lake Tahoe, you have half the population of San Francisco traversing that highway on Friday to get up to Tahoe, and then on a Sunday to get back down. So it led to, unfortunately, a lot of trauma, and we used to see, our volume of spinal trauma was probably 300 fractures a year.
And when you talk about fixation or fixating an injury, then maybe you could explain that a little more for those of us who are not quite sure what you mean.
Prior to that, if you had a spine injury, your treatment was either prolonged immobilization in a bed, in traction, and you could have been in a bed for 12 weeks, a brace, a cast, full body cast, and the complications associated with that type of treatment were very high. Skin breakdown, urinary tract infections, pneumonia, death, loss of neurologic function because the fracture wasn't stabilized and was creating ongoing trauma to the neurologic structures. So when I came back, I started using solid, rigid fixation that allowed the patient to get up within hours of surgery, mobilize, move around, and put them on the road to recovery sooner. We implemented techniques that were developed in Europe that allowed screws and rods to be used, screws that screwed into your skull if you had an upper cervical spine, screws that screwed into the cervical vertebra, the lumbar vertebra. And then we published on our results with that type of fixation. I became one of the younger people to ever be inducted into the Cervical Spine Research Society, which, if there's 50,000 spine surgeons in the world, there's probably only 300 or 400 of us in that society. And likewise, the Scoliosis Research Society. And probably in South Florida, I'm one of only a handful of people that have ever been inducted into both of those societies. And by a handful, I'm maybe 3.
So the world of spinal fixation had changed from just the thinking that immobilizing or keeping a patient still and just allowing it to heal, not having the expertise to do any type of surgical fixation, but then realizing that through surgery you could fixate and actually immobilize an area, let's say, so that it won't become complicated by normal movement or something by a patient? That's correct.
That's correct. And, we have this saying that movement is life and life is movement. And it applies to injuries. When you lie in bed for a prolonged period of time, this is not the best environment for recovery, and there's severe complications associated with that.
How long has it taken? I mean, certainly that type of medicine, that surgical medicine that you practice and learned on, that was, I guess, not widely used maybe in Europe, as you mentioned, it was being pioneered, but then moving into the United States, is that something that took a while to catch on and for the expertise to spread where doctors could utilize this in trauma cases?
It did. And in fact, early days in the 80s and 90s, this treatment was met with a lot of criticism by those who hadn't mastered the techniques. And then as the results came in and couldn't be refuted, then it led more and more people to go out and try to get trained. Unfortunately, some of the people got trained in what I call the weekend airport Sheridan and Hilton universities, meaning they would fly in, take a weekend course, and then try to do it. But that's not the way to learn. You really have to spend time and study with somebody who's an expert. You have to be there and watch them do a number of cases, and then have them help you with your cases, and it's not one or two, it's dozens of cases that you have to do before one can learn the skills. And not everybody can learn the skills. We often say as teachers of surgery that not everybody can be a surgeon. You're born with those skills. You can't teach somebody to be a surgeon. They either have those skills or they don't. It's like being an athlete. And oftentimes people will ask me, I'm in such and such a location in the country and I have to pick a surgeon. How do I pick them? I say, well, make sure that the individual, you can picture the person playing sports, because it's the same skill set, the same three-dimensional thinking and movement in space that's required. Probably after you get to be too large of a person, your hands are too big, then your ability to do some surgeries goes down. But by and large, you have to have compassion, you have to have drive, and you have to have the ability to analyze and criticize yourself. I think that those are the skill set. You have to have passion for this. But once again, if you're not born with the ability to be a surgeon, then you need to pick another career.
And yet you have the skills for this type of complex surgery. Certainly, I think it's borne out by your success and your the accolades that have been brought your way. But you now are not so much focused on certainly treating trauma, but working in a total spine health environment as compared to treating trauma cases.
About 20 years ago in California, I helped with two of my partners. The three of us developed the Roseville Health and Wellness Center. It's in Roseville, California. It's been voted #1 wellness center in the United States. It's about 40,000 square feet. We're program-oriented, so we went out and looked at the programs that the American Cardiac Association had, that the American Cancer Association had. We incorporated from an early time chiropractic, massage therapy, exercises, fitness, and we, even though I do probably the most complicated spine cases that are done in South Florida, I also have a strong interest in a non-operative approach. I think that people overlook what a positive attitude can do, what fitness can do, what other types of treatments can do. I don't like the word alternative because they're not alternative. These are the treatments that traditional medicine has always used, and maybe we've gotten a little bit away from it as time has gone on. But I treat a lot of athletes involved in the martial arts world, the fight world. I've for a long time been close friends with the Gracie family, with the Valente family out of Miami, and I've always taken a positive approach. We have another surgeon in the area, Gaetano Scuderi, who's an excellent surgeon, and also sees a lot of athletes from around the country.
So the non-surgical approach, obviously, I would assume top down, being that you are at the top for being able to do a surgery if need be, but that's not the first stop on the return to wellness for your patients. It's the last.
It's never the first stop. The first stop is trying to get the person on the right track, having a positive attitude, to be able to deal with their pain, to be able to ignore their pain in some situations, to incorporate fitness, because that will allow for your body to release its own natural endorphins, which are morphine-like compounds. And once it's only when that type of an approach is exhausted that one should think about a surgical solution to the problem.
Now, is that because the surgical solution is the only solution, or because perhaps the patient is not bucking up enough to your suggestions or your prescription for getting eating better or getting exercise?
Well, they're not mutually exclusive. There's an old saying that's used in a lot of professions: if it ain't broke, don't fix it. So, if you don't have a surgical lesion, then you don't have a surgical solution as one of the tools in your bag. But always, in every situation, fitness, weight loss, core strengthening are going to be appropriate types of treatment. Now, when those are exhausted, then you look to see if the problem has a surgical solution. It still may not have a surgical solution, and obviously if it doesn't have one, you can't offer one.
And joining us on the line right now is Alejandro.
Alejandro is the son of one of my patients. I have a great patient, Alcides, from Cuba originally. Alejandro's father was just awesome from day one. He was having excruciating back pain. He had a spondylolisthesis. What that means, the word olisthesis means that one vertebra has slipped on another, and he had a significant slip, probably more than 50%. Was a severe situation. So our first goal was to try to treat him through non-operative means: exercise, physical therapy, weight reduction, and Alejandro, we didn't meet until later on. What was your dad telling you all this time about this doctor that he was seeing?
First of all, how you doing, guys? At the beginning, when he started seeing you, we were just talking about you on the way back home, and we appreciate you so much because, like, for us, you have treated us not like our patients, like your patients, but like a part of your family, and he has been amazing since the beginning. And my dad, after the surgery was done, I mean, like how we were talking on the hospital, that he wanted to eat and he wanted to do stuff that he wanted to do. But I wish I can explain to you how thankful we are, my mom, my sister, me, my dad, for everything that you have done for us. It's amazing. You are incredible. And thank you for all the time that you have given us. You know, I was calling you around 9, 10 at night, and you answered the phone and everything. You were explaining me what to do with my dad. So thank you a lot. Thank you so much.
Is your dad there now? Is he there now to talk to? I just wondered, what is his view about all this? You know, you can't. Not every patient can I develop this kind of relationship with. The patient has to have a positive attitude, and I tell people there's really two types of patients: those that view the glass as half full, and those that view the glass as half empty. There's optimists and there's pessimists, and from day one, even though your dad was in excruciating pain, he'd have the occasional smile, and we made the connection in that way. And without the patient doing what they need to do, there's just no way you can get a good result. Alejandro, ask your dad, Alcides, what was your first impression of whether you were going to get better or not? From day one, how did you view what your recovery was going to be like?
Que fui con miedo, fui valiente, porque tuve miedo, pero como le tengo confianza, fui.
He said that at the beginning he was really scared. I mean, he didn't know if he wanted to go for it or not. But I mean, he was telling me that you give him a strength and confidence in you to go on with the surgery. And after like few times that you guys see each other and you talk to him, he said that he felt comfortable and he was feeling sure about going on with the surgery.
Well, by the way, the surgery that we had to do on Alcides was a fusion of L5S1. We had to go in through his stomach, move his intestines away. We had to move the great vessels away, and then we reduced the slip, meaning that we put it back in position and then held it there with a plate and screws and flipped him over and put in screws percutaneously through just like a micro technique in the back. And I think he was your mother was more surprised that he had just these little small puncture wounds, and yet the X-ray shows that he's
she was thinking that it was going to be this huge thing in his back, but when you took everything out and it was this little scratches, literally, it was really a big relief.
Well, listen, I think your dad's going to do great. I want to wish you, your dad, your mom, your entire family a very Merry Christmas, and I'm looking forward to seeing you back right after the New Year.
Thank you a lot. Definitely, he's doing way better. A little bit of pain, but I mean, he's great. He's walking around. He's standing up by himself already, and he's doing great.
All right. Well, Alejandro, thank you so much for joining us and giving us your thoughts and interpreting for your father, and we appreciate you being on with us today. You're listening to The Road to Better Spine Health with the Spine Doc, Dr. Pasquale Montesano, MD. And he is with the Montesano Spine and Sport with offices in Palm Beach Gardens, Naples, San Juan Capistrano, California, and throughout the world. I'm Brian Content. I'm here with Dr. Montesano to help kind of facilitate a discussion, a very important discussion, because so much emanates from good spine health as to how the rest of your body is going to react on a day-to-day basis. Dr. Montesano, your success, I think, has got to be predicated on your relationships with your patients. And I think getting them to buy in, getting personal, being able to, associate with them and really getting into each other's heads, people buy into that and get that turn on from establishing a good relationship.
Well, Brian, I said earlier that it takes two. It's not it's not the doctor in isolation. You have to have a motivated patient, a patient who wants to get better, who's willing to put the work in. I mean, you know, that's one of the problems in our society right now. You know, I heard somebody use the term we're the society of everybody gets a trophy, and everybody doesn't get a trophy. The trophy only goes to those people that work, and it doesn't happen without hard work. I don't understand why people, patients, they watch television, they see athletes get injured, they see notable people get injured, they hear about what that person has to put in to their recovery, the sweat, sometimes even the tears, and you're not going to achieve the results that you hear unless you put that kind of work into it. It doesn't just happen.
Now, you know, working with athletes, of course, special people who are, you know, toned and fit and strong, and but that's not your typical patient necessarily either. Can you wring out that type of drive and perseverance from those who are perhaps not as physically able?
Absolutely. And you know, while everybody might not have the same degree of fitness and athleticism, I think you need to take the same approach. I take the same approach with everybody, and it's a sports medicine approach. That sports medicine term is not just reserved for the athlete, but it really has the connotation of an active approach, getting the patient engaged in their own recovery process.
If you're not as fit, if you're not that type of patient who's the athlete, again, the relationship, the trust, the you know, back and forth, the being able to understand and work towards something together, I think would have to be a key to success.
Absolutely, Brian. And, you know, the first day I see the patient, it's like a tryout. You know, they're trying out for my team and I'm trying out for their team. And they may not put me on their team and I may not put them on their team. And I can really tell from day one who's going to get better and who's not going to get better. And you know, you're hearing from people that were very positive in their thinking. And if somebody doesn't have that approach, well, then I don't anticipate that they're going to get the same result.
Now, how do you deal with that with a patient when you can see
it's
where this is going? It's
heartbreaking because, you know, my goal is that to try to help every patient. You know, oftentimes I'll be listening to the patient and I'll be thinking of, you know, my own family, my own mother, you know, who was paralyzed, and boy, what she wouldn't have given to just be able to do a little bit of what some people just turn their backs on.
Mm-hmm. That experience, of course, has obviously led to your drive in becoming the best you can be, but also the compassion. And I know it's part of a bedside manner that's taught to every physician, but you've really kind of grabbed onto that, because the people you deal with, spine injuries and the pain, and are truly the most horrific types of injuries and cases, I would think, that any doctor could see.
Absolutely, absolutely.
Now, you had talked about the treatment, the A2M treatment, and I'm very intrigued by the whole notion of reducing inflammation. So talk a little bit about what A2M is actually and how it works towards the process of recovery and treating spinal disorders.
Well, you know, the brains behind that was another local surgeon here, Gaetano Scuderi, who's an amazing guy, amazing family, amazing surgeon, and an amazing fighter, by the way, which is maybe more of his love than. But at Stanford University, it was his lab, and I am a small wheel in that piece of machinery, but he's the big wheel, and he came up with alpha-2 macroglobulin. I was one of the first people to use it, and I probably have the largest series now in the world. I've treated over 100 patients, injected several hundred discs, but you know, it's the only biologic that has any science behind it. If you look at, you know, in this topic, Brian, always creates an emotional discussion. So I try to stay away from the emotional part of it. And when people ask me about the other biologics that are out there, one of them is called PRP, platelet-rich plasma. I say, look, there's over 30 papers written on it. All of them conclude at the end that no positive effect can be found. So I just direct people to the American Academy of Orthopedic Surgeons website, and I say, listen, don't take my word for it. Read what they have to say. Mm-hmm. People will then ask me about stem cells. And I say, look, if a doctor talks to you about stem cells, first you should consult the FDA's website, see what they have to say. They're not very positive on it. But you draw your own conclusions. And I also tell them, ask the doctor to show you the package insert, because all of the companies have had to redo their insert so that the word stem cell is not in there, because labs that have analyzed these different products, non-biased labs, haven't been able to find any functioning stem cells. So they have to use the word in the package, write up progenitor cell or active cell or something like this. And whatever it is, there are no papers that have been accepted peer review wise that demonstrate a positive effect from that either.
This is The Road to Better Spine Health, a weekly program with the spine doc, Dr. Pasquale Montesano, whom you've been listening to, who has offices in Palm Beach Gardens, Naples, Florida, San Juan, Capistrano, California, and around the world. From time to time, we will be joining him from various places, perhaps throughout the U.S. and throughout the world, for special interviews and discussions. As we get our new program going over the course of the coming weeks, we may be hearing from Dr. Montesano from who knows where. But I believe we got something special coming up here for next week's show. And that will be hearing from you from Italy, I believe.
Yes, that's correct. I'm going to Rome. I have a little tradition of celebrating Christmas at the Vatican. I'm also going to be visiting with one of my patients there, who's actually one of Rome's distinguished general surgeons. He's a colorectal surgeon, former chief at the San Giovanni Medical Center in Rome. Now I think he's moved to a different hospital. So I'll probably be visiting with him, and he had chronic knee pain for about 3 years from a motorcycle accident. Very active, very athletic guy. Had been operated on twice before, and he heard about the alpha-2 macroglobulin and flew to America. We did the treatment here, and I'll let him tell you about the result that he had and has continued to have when we talk to him next week.
Okay, very good. And I want to give you a phone number of 866-79-DR-SPINE, like Dr. Spine, 866-79-DR-SPINE is the number to call, or visit the website, spinedocs.org. spinedocs.org. Check it out. Check into Dr. Montesano's background. There's plenty of information on there for you to learn, and Dr. Montesano is one of the best in the business, clearly. And for now, I'm Brian Content saying have a great day.
And have a Merry Christmas, everybody.